and I will be taking you on quality control in a histopathology laboratory. I know that generally you'll have been introduced to what quality control is generally in the laboratory, and maybe probably you may have been taken through um, different laboratories and quality control. But in histopathology laboratory, the way we handle our quality control is totally different. And the way we do things in histopathology is totally different. But don't forget, the main goal is for us to ascertain quality, or to ascertain that our results or what we are producing are quality and are patient focus, centered toward patient care as much as possible. That is very, very important. So now, there are learning objectives that I've set up for these teachings, and which include at the end of this lecture, you should be able to understand quality control principle in histopathology. If you're able to identify the quality control steps in each lab phase, very, very important. And you will be able to also recognize common errors and solutions, and also apply QC practices in daily work. Very, very important. So now, if I may ask, do you work in the general lab, or you also work in the, or you are majorly working in the histopathology laboratory?
Histopathology lab.
Okay, that was good. So I asked that so that I can be able to know the depth I should go in for you. Now, in Nigeria, right?
Yes.
Okay. Now, what is quality control? Generally, as I was saying, quality control is the monitoring of laboratory process to ensure accuracy. Very, very important. Monitoring of laboratory process, that is each step we take in the laboratory, everything we do in the laboratory, we monitoring it and ensuring that accuracy and precision is being maintained. Very, very important. Now, we also ensure reliability and reproducibility. That is what quality control also ensure. And also, it assure us of quality, and that is what we call quality assurance. So that is like the basic definition of quality control that I want to give to you. So just note at the back of your mind things that we put in place for us to ascertain quality, precision, and accuracy, geared or centered toward patient care, is quality control. Now, importance of quality control. Importance of quality control. The first thing is that we implement quality control in the laboratory to ensure accurate diagnosis. That's the first thing, to ensure accurate diagnosis. Then, due to many errors that used to occur in the laboratory, we implement quality control to reduce those errors. We implement the quality control to reduce those errors. And also, quality control also allow us to improve patient safety. Very, very important. It allows us to improve patient safety. That's one of the importance of quality control. And also, aside that, there is aspect of laboratory accreditation. which the key aspect of the standard of accreditation is QC, that's quality control. If they come for audit in your laboratory, one main thing that they must look at, if they don't even look at any other thing, is quality control. So there is need for them to ascertain that your quality control are adequately and working very well, are adequately working well in order for you to ascertain the quality of what you do in the laboratory. Very, very important. Now, histopathology workflow. You work in the histopathology laboratory. Before I go into the details of histopathology workflow, let me just give you this understanding that we have the pre-analytical, we have the analytical, and we have the post-analytical in the histopathology also, the way it also applies to other laboratory. Very, very important. You need to get that understanding that we have that flow too in histopathology. And the workflow in histopathology, as you may also have been familiar with, include the sample or specimen reception. That is the first thing. When you receive your sample, in each steps of your sample reception, there is definitely or there is need for you to include the necessary QC at that point. That is the quality check at that point. For you to be able to receive your sample properly, label it properly to avoid mislabeling, because that is like a form of gross error in the laboratory when you mislabel sample. So there are checks that we put in place to ensure that we didn't mislabel or mishandle our sample. Very, very important. And the aspect of the physician in the laboratory workflow is also very, very important in histopathology. There are quality checks that we ensure or that we put in place to ensure, to ascertain that our tissue is well preserved. And if I may also say, histopathology has its own QC. Cytopathology or cytology laboratory have its own QC also. Because, we deal with tissue mainly, histopathology, while cytopathology, we deal with cells. Cells, we deal with cells, which is different. Are you getting what I'm saying now? So now, when we're talking about fixation, the way we handle our fixation in histopathology is totally different from the way we handle the fixation in cytology laboratory. So coming back to this now. Now, ensuring that your tissue is properly fixed, there are adequate quality control check that need to be put in place that you need to follow to ensure that that's part of the workflow in histopathology. And after that, we move to the cutoff, that is the macroscopy, which we call grossing. And that is another area. That is the dissection aspect of the histopathology laboratory. There are also quality checks that are put in place in that aspect or when that is being carried out to ensure that error does not occur. It is after the cutoff that we get the what do you call it? That we get the little tissue or small part of the tissue that has been cut and then placed into the cassette before we send it for tissue processing. Now, when we send it for tissue processing, during the tissue processing stages, each of those stages of tissue processing also have quality checks that need to be put in place to ensure that quality tissue processing output is being achieved at the end of the day. So very, very important. So now, after the tissue processing procedures, we now have the embedding. When you are carrying out your embedding also, there are adequate QC check that need to be also be put in place when you are carrying out your embedding. That is when you will be able to ascertain that your embedding was properly performed or carried out. Now, this aspect of the embedding, including you ensuring that the patient you are dealing with, the identification now of the patient you are dealing with also tally with the identification of the block you are embedding or the tissue that you are embedding. One part of the QC check that you put in place is to ensure that you carry out your embedding one after the other. Then you ensure that the tissue block, the tissue, the type of specimen that is being processed or that is supposed to be for that particular patient is also what you are also embedding. You avoid cross-contamination when you're carrying out your embedding, maybe through your forceps, cleaning of your forceps individually or step by step at each stages of carrying out the embedding. Very, very important. Then the way you handle your forceps and the way you also handle your embedding modes, very, very important. So those are the type of quality checks that have been put in place to ensure that we have a good or a great outcome of embedding. Now, when we are talking about sectioning, it's another aspect that also have their own checks, quality checks that need to be put in place. When we are talking about sectioning, that is a microtomy, and mostly rotary microtome is being used when we are carrying out our microtomy in the laboratory, except now that we are now having the advent of automatic microtomes now, but not really too common for now. So now in sectioning or in microtomy, there are also a lot of quality checks that need to be put in place for you to be able to avoid errors and issues. You know, is it in handling your microtome? Is it in setting the necessary or the appropriate measurement that need to be checked? If you are using 3 micron, if you are using 4 micron, if you are using 2 micron, depending on the type of tissue that you are cutting, you need to take absolute notice of those things. Very, very important. You need to be aware. Very, very important. And then you need to also know when to change your blade so that you can be able to avoid some artifacts that can be created on your tissue section. Very, very important. So after microtomy, when you are also floating your the section, there are also adequate QC or quality check that you need to also put in place as you are floating your section in order for you to avoid one scattering, in order for you to also avoid carryover, in order for you to also avoid tissue rupture. There is need for you to know how you handle your floating effectively. Very, very important. And when we are talking about staining, that is after you have already gotten your section, talk about staining. And in staining, there is need for you to also put adequate what do they call it? Quality check in place. Starting, are you with me?
Yes.
Instead, there is need for you to put adequate quality check in place. And what is quality check you put in place when you are doing your staining? In fact, it's one of the main area. So now you need to be sure that your equipment or your machine is working very well. If you are not using machines, if it is manual staining that you are doing, hand staining that you are doing, you need to ensure that your reagents are being batch controlled. Your stain are being batch controlled. That is everything you are using in your staining. Let me use H&E for example, hematosine and hyoscine. Your hematosine that you are using, the batch lot that you are using need to be batch controlled and be batch accepted. How is that one done? When new group on new lot of reagent and being supplied to your laboratory. Before you start using them, there is need for you to carry out batch acceptance testing. And the batch acceptance testing that you carry out is for you to be able to ascertain the quality of the batch. Let me explain how it works for you. When a company produces a set of hematology reagent, for example, this is applicable to all the reagents. When they produce a set of hematology and you're saying hematology, for example, hematology stain, for example, when they produce that, they produce it in lots. Let me say they produce 10 for 4 liters. So when they produce 10 for 4 liters, all of them will have the same lot number. That is what they produce once at that particular time. That is, all of them pass through the same stringent control or stringent measures. So when they get that, that is why you will see all those numbers you used to see on reagent. They are not just for fun. Those numbers that you are saying there, that they will say lot number, batch number, they are not for fun. It means that those sets, if those ones that carry that number and they are the same, they all went through the same condition, the same measures when they were producing it. So now, when you buy that batch or that particular lot, there is need for you to test that lot, that is batch acceptance. You test it and you ensure that they can produce the quality that you are expecting, comparing with the known control that you have. When you have ascertained that, that is when you cannot be able to say, okay, this lot or this batch of reagent that I purchased or that has been sent to the laboratory, that has been batch acceptance, batch control and batch accepted in the laboratory. So that is very, very important. Then aside that, so this one I just said now cut across all the reagents that you are using for your staining. Now, after you have ascertained that, you need to also do that, what do they call it? Every morning when you get to your lab, there is need for you to run QC slide for your stain. Before you load patient slide in your machine, there's need for you to run your daily QC. It's done daily. When you will have your slide, which contain the section, control sections, and you run it in your stain. And when you run it in your stain, you can check it and confirm that it is the quality is optimized before you can now be able to move on or continue loading or staining other sample. Very, very important. Now, from the staining to the reporting, at the reporting, because after staining, definitely the block checking will be done before it's being checked and before it's being sent to the pathologist or the pathology or who will read and report the slide. Very, very important. So the quality control is applied at every step, as I've just mentioned to you. Is applied at every step or in histopathology. And this is just like a form of illustration that I put here in your tissue sample. As I just explained to you, there are quality control that involve at that stage. The fixation. During your fixation too, there are quality control check that they also involve at that stage. In every stage, I just put this other one there, karyotomy, ultra karyotomy, and others. The embedding, there are QC checks that are involved. The same thing is also repeated here. That is, even in immunohistochemistry, control or QC are also involved at that stage. Now, key quality control concepts. As I've told you before, accuracy and precision is very important when we are dealing with QC. You need to understand that accuracy and precision is one of the reasons why we are doing quality control in histopathology. Another thing is reproducibility. For us to be able to reproduce any result we get in the laboratory is one of the key concepts of QC. Another thing is a standard operating procedure. Very, very important. There is no how you will say you are performing quality in a laboratory when you don't have SOP or when you are not following the standard SOP that you're supposed to follow. Are you getting it now? So there is no how you can be able to say you are performing quality. So QC and standard operating procedure are very, very important in the laboratory. Even definitely, all your QC check or all the QC that you have in the laboratory, each of the stage, you have the adequate SOP that or approved SOP that back them up. Are you getting what I'm saying now? Then there's no how you talk about QC, quality control, that you will not talk about documentation and that you will not talk about traceability. Documentation and traceability are very, very important in the laboratory when we are talking about quality control. I just made this lecture to be a bit practical wise, like, because I don't just want to like be reading theory for you. So that's why I'm trying to like explain to you in a practical way so that you can visualize what is expected or what you are to do if you have not been doing it before, or for you to have the good understanding of how quality control in histopathology, how it works. Now, we have different types of QC. We have internal QC. When we talk about internal QC, that one talk about daily checks. So if I may ask, what are the daily checks that you perform in your laboratory now? What are the daily checks? If I say daily check, if I may ask.
Okay. Daily check is to like the formalin. We have to check that the formalin is not bringing up depositions. It's not precipitating, it's not forming, it's not undergoing redox reaction. So that will ensure that it is daily looked at least between the time of preparation and the time of usage. There should be no deposit particle substances present. So that is what part of the things that we do. Then there are other things too, like we still look at the sampling during grossing. So when you sample, you take the part that it is usable for processing. So it's also good that we color the sample, the very small one, biopsies that you were working on. We may endeavor to color it so that we don't get them missing in transits. So those are part of the quality control we take or we check daily.
Okay. In some way you might be right, but let me put it very well for you so that at least you can be able to place it properly. Yeah, what you have said is okay, it's not bad, but let me elaborate it for you, or let me explain to you better. Now, when we mean internal QC, internal quality control, that is, it involves the daily check. In the laboratory, there are important daily check that we need to carry out. Are you getting it now? Now,
Yeah.
the first thing, or don't let me say the first thing, part of the thing that we used to do or that we used to check daily in our histopathology laboratory is our temperature. Our temperature. I don't know whether your laboratory, if they have any temperature chart at all in the laboratory.
No.
So they are supposed to be a temperature chart and a temperature, a thermometer, a room thermometer for your temperature. Very, very important. Then, where you keep your reagent, you need to have refrigerator temperature. You need to have refrigerator temperature. Very, very important. Are you getting what I'm saying now?
Yes.
Then, your microtome, there's need for you to have daily check on the not maintenance now, the setting up of your microtome daily. Are you getting what I'm saying now? To
Okay,
check,
that yes, that I do, but sometimes not regular.
but it's
Okay.
supposed to be regular, and it's not even that you are doing it's supposed to be documented. I mean, it's supposed to be chart. You understand what I'm trying to say?
Okay, okay, okay. That is missing.
Yeah. So it's supposed to be there. So you have chart that okay, today there are some times that there are some days that you may not use the microtome. Is that not so?
Yes,
So if you have the chart, you'll be able to know, okay, this day they didn't use it, this day they use it. And what the chart used to contain mainly is for you to, okay, for you to say that, okay, you ensure that your gauge is set, your gauge or the measurement is set at the appropriate gauge. You know, there's a way you check it, you tick it. Then the handle, um, I mean, the microtome handle now is rotating effectively. You check that, you check it,
so
you
they
check,
fly with.
uh, yes, the wheel, yes. That's what I'm trying to say now.
Yes,
Then you check the your water bath, temperature. What is your SOP? You ensure that okay, that's the temperature that is also there. Maybe you say okay, from 40 to 45 or from 38 to 48 is your temperature range or something. Then when you put your water, before you even start cutting tissue or anything, you notice or you take note of the temperature there. You write it down in your daily distance. So you will do it for like 30 days. That is, each of the paper will be for 1 month. And you will keep those things as a record of how that microtome is being used. Are you with me?
yes,
Very, very important. So you capture that. Then aside that, you people do manual staining, right?
yes,
Okay. So if you people do manual staining, they are supposed to be also be checked for your daily this thing, for your daily stain. Supposed to do you're supposed to have a daily check for that too, so that you can be able to capture which day do you put new stain, new methocillin, new eosin. There's a way you can design something like that. All these things are daily check for you to know if there's any non-conformance that come up. You can be able to easily trace, carry out root cause analysis and trace where the issue is coming from. Are you with me?
yes,
So that is very, very important. So that is on your stain. Now, aside from your stain, still on the stain before I leave there. Every day, you cannot just come and just load patient slide inside the stain. Every day, you're supposed to run control and you need to be documented. Do you do that? No.
well, poorly documented.
Poorly documented, which is not supposed to be. Because that's one of the key aspects of stain, key aspect of histopathology rather. Every morning before you load your sample, you first of all check. Since you are doing manual, you will check your methocillin. There are sometimes that there is need for you to even sieve. You need to sieve that methocillin. You don't need to
Yes,
sieve your methocillin.
yes,
You need to sieve it. Sieve it. When you sieve it, when you sieve it, every day you are supposed to have quality control slides. Let me explain, because that is one of the knowledge you are supposed to gain from it, especially on
yes.
that stain. If you didn't gain anything, at least on that particular staining, which is very, very, everything are very, very important that you're supposed to learn, not even on that staining alone, but that staining is very much important. So now there is something we call QC slide for stain. This is the way it used to be. I don't know the type of sample that you used to receive regularly in your laboratory, but QC
Breast,
slide.
prostate,
You say?
breast, prostate.
Breast, prostate, under the hair. So now you're supposed to have like what do they call it? Breast, some part of breast sample on that slide. I mean, on a block now. You will do a block. You prepare a block. Maybe some breast that you people have already examined before they maybe discard it or something. You do a block that you put small, after the tissue, you process the tissue, process small part of the breast, small part of the prostate, small part of liver, small part of skin, like that, on a block. Are you getting what I'm trying to say now?
Yes.
On a block, on one tissue block. So after it's being processed, you embed it all together like that. Then you can produce many slides from it. That block now, you will call it QC block. So from there is where you'll be producing many. You can cut like 20 slides and keep. You label your this thing. You call it QC slide. Every morning when you come, before you load your this thing, before you stain any this thing from your with your stain, you will label. You will pick one of the QC slide, label it H and E, put date, put your initials, H and E QC. That's what you will put. You understand what I'm trying to say now?
Yes.
H and E QC, put date, put your initials. Then you will now stain just that one slide. After you have sieved your stain, if you use to sieve it, depending on the type of hematosine that you are using, you will now put that slide in here and stain that only one slide. When you finish staining that one slide, you will now view it under the microscope and check, do you think the staining is optimal enough or is not optimal enough? We will still get there. I will still show you an example during this teaching. So you will check it under the microscope. Is it optimal enough? Is it not optimal enough? So that one will guide you that, okay, you have done the QC for your staining today. What I'm teaching you now is international best practice. You will now confirm that is this what do we call it? Is it quality enough for you to use for the day? So if you confirm that it's quality enough, you have something that your QC checklist that you will now score. You will score it that, okay, maybe there are sometimes some people they use 0 to 5, some people they use 0 to 2. If it's okay, they will say, okay, it's a 2, 1, 2, 1, depending on how you rate the staining quality. Do you understand what I'm trying to teach you?
Yeah.
So that is this, and you take the record. It's supposed to be done daily when you are in the laboratory. Maybe except Saturday and Sunday. If you didn't go, you can leave those one empty. You don't need to be filling those one when you are not here. You were in. So that is the way it's being done. So that is that. You do that mainly for your this thing, for your stain also. Are you with me?
Yes.
I hope you are grasping your understanding here.
Yeah, yes, I'm getting you.
So that is how QC in staining is being handled. So now, when you run that, one of the reasons why you are running that is for you to know if the staining, if your stain, or if by the time you finish the staining, if the outcome is suboptimal, you can be able to know that, okay, there is need for me to change the hematosine, there is need for me to change the eosin, there is need, because you will know when you view it, when you view your QC under the microscope. Are you get what I'm saying now? And one of the major reasons is that it will save you of maybe you now staining a lot of slides at the same time, and at the end of the day, you now discover that all the slides they didn't stain very well. This is why people doesn't used to do all these things in Nigeria most of the time, is that they just think that, okay, we are not doing much of histo, so let them just do it anyhow. No, it's not supposed to be. So those are part of the internal QC, part of the daily check that we do in the histopathology laboratory. So I'll talk about the one of the staining. talk about the one of the myotomy, then the one of even the tissue processing machine. Do you use tissue processing machine or you also do manual?
Wow. We do sometimes, although shall we normally do we use a processor, but the automated processor is bad now, so we do manual.
Manual now, present day. Okay,
Mm.
so that is it. Even when you are doing that, whether processor or manual, there are also quality checks that need to be put in place at each stage of your tissue processing. But then aside that, we have external quality control, which is proficiency testing, or because sometimes we call it EQA. Are you doing any EQA for now in your Histo?
No, not really.
So that's
But
what it is.
Roach does the IAC.
Okay, your okay, you enjoy your RC, okay. Okay. Ordinarily, the external quality control, external quality assurance in the Histo laboratory in Nigeria, we don't have facility that are really handling that for now. Don't
Yes.
have facility that are really handling that for now in Nigeria. But there's need for you to be aware that we have QC in histopathology where they check. They can send some slide to you for you to stain it. You know how EQA work, right?
Yes.
They will send some sample to you that is known to them. They know the quality of the stain with them. They will send some sample to you that they want you to run. So when they send those samples to you, then you will run it. Then you will send it back to them. Then they will check, or you will send the result back to them. They will check and they will give you response. Then they can also check the quality of your tissue processing. They can tell you to send some tissue to you for you to process. They want to check the quality, so they will give you the results. All those different stages in your lab, they will just carry out this thing, and then they will give you a report back to tell you, okay, this one over 10 you scored this one over 10 you scored this one is the issue you have, this is the issue you have with this is the issue you have with that. That's the way. And at the end of the day, you'll be able to see where you are falling. You can be able to do a critical analysis, carry out root cause analysis, and be able to know where issue is coming from, and you can be able to now know how to address them. You carry out a corrective action and preventive action on any non-conformance that's being raised or where the issue is coming from. Are you getting what I'm trying to say now? So
Yes.
that is that. Then we have preventive QC. What do we call preventive QC? That is adequate maintenance of your equipment. You know, if you suppose you have many equipment in your laboratory now, even with the little you have, you are supposed to be doing maintenance of them. So sometimes it's periodic. We carry out periodic maintenance on equipment, on some equipment in histopathology. If you're supposed to have a staining machine now, there is a periodic maintenance that we carry out on them. So tissue processor machine too, we have also carry out periodic maintenance on them, and other equipment that you have, even microtome, carry out periodic maintenance on them. Why are you carrying out those maintenance on them? That is what we call preventive QC. That is, you are preventing sudden damage. You are preventing sudden downtime, sudden failure of those equipment. That is why you are carrying out preventive, that's why you are carrying out maintenance on them. That's why you are doing the necessary calibration you are supposed to do to ensure that we avoid any form of downtime of any of those equipment as much as possible. Are you with me? So that is that. So that is preventive. QC. That is preventive QC. Now we have the pre-analytical stage. Are you with me? We have the
Yes, sir.
pre-analytical stage, or pre-analytical stage in histopathology. The QC involve focus before processing, correct patient identification. As I mentioned, correct patient identification is a form of QC that we carry out in histopathology. That is under pre-analytical. You also have proper labeling. Proper labeling. That is the ID and the site where the sample is coming from. Very, very important. Also, we got adequate fixation. That's need to ensure that the proportion or the percentage or the ratio of the tissue to the fixative is appropriately covered. Are you getting what I'm saying now? So very, very important. So that is to ensure that the sample is being fixed very well. That is being fixed very well. Very, very important. So now, then we also have the specimen integrity. Specimen integrity should be maintained at all costs. Specimen integrity should be maintained at all costs. Very, very important. These are different machines that and the computers that we use when we are tracking samples and the rest. So it's not like to give to you. So you need to also understand pre-analytical errors. Pre-analytical errors. The errors that do occur if proper QC adequate QC quality check are not being put in place pre-analytically. Include mislabeling. When you mislabel your sample, it's a big error. Inadequate fixation is a big error. Missing clinical details is a big error. So mostly the main three errors that used to occur on when we are talking about pre-analytical aspect of histopathology are these ones that I've just mentioned to you. So we have the analytical QC. The analytical QC, that is during processing now. When we are processing our tissue now, that's where the main analysis started. Is starting. That's where the main analysis starts, rather. So now we have tissue processing. In our tissue processing, there are necessary QCs that need to be put in place. I mentioned it before. I don't want to go to it too deep again. In our during embedding, we have QC that need to also be put in place during embedding. And we also have QC that need to be put in place during microtomy. Very, very important. So now, during staining too, QCs need to be put in place. So, how will what do I want to say again? So under the microtomy, I think I mentioned some, I pinpointed some QC or quality check that need to be put in place when you are carrying out your microtomy the other time. So please take note. It's also very, very important. You have to do or cut your blocks one after the other to avoid mix up, to avoid giving or giving another person's diagnosis to another patient. So there is need for you to be careful, and there is need for you to follow the adequate SOP, appropriate SOP, or the accepted SOP, so that you can be able to get the quality section required of you as much as possible. So very, very important. And this is like a example of a ribbon of section that is being gotten. So QC in tissue processing. What are the QCs in tissue processing? One, check your reagent daily. The quality is being checked. That is the quality of your alcohol, the quality of your xylene, the quality of your paraffin. You check the quality. That is one of the quality check and one of the quality control when you are talking about tissue processing. In this your manual procedure, manual processing that you are doing, you need to ensure you check your reagent quality. Don't just leave the set of reagent that you have been using to carry out tissue processing for the past 6 months. Is it the one you are using after 6 months? That is bad. So there is need for you to check the quality of your reagent that you are using for your tissue processing. You need to check them regularly. Very important. You need to also monitor processing schedules. Monitor processing schedules. So by the time you monitor your processing schedule, it will allow you to be able to know when did I need to change this reagent, when did I need to change that reagent. Do you understand what I'm trying to say when I talk about monitoring processing schedules? Do you understand? Are you there? So when I'm talking about monitoring processing schedule, there's need for you to understand that each schedule or each stages of your each stage of your what do they call it? Each stage of your tissue processing, you monitor it. You also monitor the schedule of your tissue processing to ensure or to be able to discover, be able to know when reagent need to be changed. Are you guys what I'm saying now? Then you need to also ensure proper dehydration and clearing as much as possible. Ensure proper dehydration and proper clearing as much as possible. So these are very important when we are talking about QC in tissue processing. Then QC in embedding. As I said the other time, you need to be able to get correct tissue orientation. If your tissue orientation is not being done correctly, it's a problem. It's a problem. It's a problem. So correct tissue orientation, very important. When you're also doing your embedding, avoid air bubble. Avoid air bubbles. Very, very important. You need to also ensure proper paraffin quality. Ensure proper paraffin quality. That is your wax quality. Ensure proper quality of it. Very, very important. So now, QC microtomy, as I said, consistent section thickness. If you are using 3 micron, let your 3 micron be consistent. If you are using 4, let it be consistent. If you are using 5, let it be consistent. Very, very important. And you need to also ensure that there is no fold. That is, you need to be able to cut ribbons of section straight without any fold as much as possible, without any tear. Definitely, you should know that when there is tear, you need to change your what? You need to change your blade. Am I communicating?
Yes.
You need to change your blade when you are expecting tears. You need to know what is really happening. Tears can be caused by different factors. So you need to have the ability to discover what is causing the tear and address it appropriately. You need to know chatter. If there is chatter, you need to look at it. What is causing the chatter? Is it the blade, or maybe the tissue was not well processed? All those reasons, you need to understand it. Very, very important. Then sharp blade usage. When you want to produce a section, using your sharp blade will allow you to get a very good ribbon of section devoid of lines. That is blind now. Devoid of any form of tears and devoid of shatter. All those things very, very important. You need to take them into contribution. Then QC is staining. Yes, I explained to you the other time that when you load I've already explained the process to you. When you load your daily QC in your staining machine, or when you are staining your daily QC, there's need for you to know what you are looking at after you have stained. What you are looking at mainly is your nucleus and your cytoplasm. Your nucleus and your cytoplasm, you should be able to know what color your nucleus is, what color is your cytoplasm is your nucleus stain, did your nucleus stain properly, or that your cytoplasm stain properly according to your what is being displayed, or according to what is required. You need to understand that. Very, very important. Then you need to check overstaining and understaining. Does he overstain? Does he understain? Is it suboptimal? You need to understand that as much as possible. Then you need to also check the background. Is the background clean? Is it dirty? All those things. Those are the things that you are going to look for you to be able to give that score that I'm telling you. And all these things need to be documented inside your QC checklist. Are you with me? So very, very important. Common analytical error. Common analytical error. Tissue folds is one of the common errors that we have. We have shatter, that is what we call vibration marks. We have uneven staining. That's another thing. We have tissue detachment. That's another thing that we call our common errors that we do have in the histopathology laboratory. And all those errors can be addressed when you handle your QC, quality check, and the necessary quality control properly. Now, post-analytical QC, after processing, verify the slide labeling. Very important. I hope you are with me. Verify your slide labeling after processing. Very, very important. Check cover slipping quality. Very, very important. Ensure report accuracy. Very, very important. And also proper slide storage. Very, very important. That is post-analytical QC. So daily QC checklist. If you are there, daily QC checklist. Check control slides. As I said, very, very important. Check control slide. Now, monitor equipment. Very, very important. Your microtome, your water bath, you need to monitor them. You need to have a chart for them. Then, temperatures. I've mentioned the room temperatures, the refrigerator temperatures. Very, very important. You need to monitor them. You need to capture them. You need to take the you need to feed the checklist. Are you getting what I'm saying now? Then you also need to inspect your staining quality depending on the load of sample that you have. You need to do that. So periodic QC task. Periodic QC task. We have one of weekly when you must replace some reagents, cleaning of equipment. You need to note that. Very, very important. Then we also have monthly QC. That is when you review your QC logs, audit errors, and so on. Very, very important. Then we have some I put some examples for troubleshooting. I put them here. Maybe when you do your staining and you have paste staining, the cause is weak stain. So that one is showing that you need to replace your reagent. When you have food, as I explained to you earlier, that is post sectioning. What you need to do, you need to adjust technique. When you have chatter, it means that your blade is dull and you need to change blade. And when you have tissue loss, that is poor adhesion. Poor adhesion when you have tissue loss. So you need to record and then you use coated slide. That is for sometimes some people they call it sticky slide. You use it so that there will not be tissue loss or tissue lifting. Are you with me now? So documentation, QC log, daily record are very, very important. All those things that I've mentioned to you, daily QC in the laboratory, your QC log, daily record, taking them properly, very, very important. Then equipment maintenance log. Equipment maintenance log. If you are maintaining your equipment every 6 months or every 3 months or one year, make sure that you maintain the log, you maintain the record. Very, very important. Then incident and error report, the documentation of it, very, very important. Every NC, every incident need to be captured, need to be reported, need to be captured, need to be documented. Very, very important. And remember the what we used to say in quality, if it is not documented, it's not done. Or if it's not documented, it didn't happen. Now, training approach, observation, supervised practice, independent work, and continuous feedback. Those are the training approach. When this has been put in place, you are good to go. So we also have competency assessment. And when we talk about competency assessment, what you need to do is for you to evaluate the slide quality. You evaluate the error detection. You stop adherence. Then you make sure that your documentation are accurate. Very, very important. So best practices. You follow SOPs strictly. Follow your SOP strictly. Are you getting what I'm saying now? Maintain cleanliness. Very, very important. Communicate errors immediately. Very, very important. Then keep learning and improving. Very, very important. And I will have to like conclude with this. QC is essential at every step in histopathology. Are you getting it now? And what you must put at the back of your mind is what I'm doing, I need to perform quality. I need to put necessary QC in place for me to be able to achieve quality output or quality result. Very, very important. Prevent error before they occur. You need to prevent error before they occur. And you need to be consistent. Consistency is equal to reliable diagnosis. Again, consistency is equal to reliable diagnosis. So I want to thank you for listening to this teaching and lecture on QC in histopathology. My name again is Dr. Samuel Fashogban. So I welcome your questions if there are any. Thank you so much. Are you there?
Just hold on, let me answer. Hold on. Just hold on, please.
Okay.